Anger. I mean, this is really, 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 truly honor for me because we are here in front of the mother of mindfulness, the mother of positive psychology, with 4 distinguished scientist awards, 1 Genius Award, and the first woman with a tenure at in psychology at Harvard University. Oh my goodness, this is incredible. So how
Thank
how
you,
how
Louis.
can you accomplish all this in one lifetime?
I'm pretty old, so there were many opportunities.
Well, we're here to talk about your new book, and we'll have time to go through the key insights. But something that is very remarkable is, I mean, in this case, you focus on mindfulness and the body, but at the same time, you link this with health. So I think if there is a
Yeah.
moment to talk about the connection of mind, body, and health, is now. So thank you
Okay.
so much for this book. Why don't we start with the core? So where are we going? What
Okay.
what are the highlights of this book?
Okay. Well, a large part of the book is about mind-body unity. It's one unit. Now, dualism, you have a mind, you have a body, that's what most people believe. And then the question is, how do you get from this fuzzy thing called a thought to something material like the body? I said, this is nonsense. Let's put the two back together. Then wherever you're putting one, you're necessarily putting the other. Now, I first tested this back, oh gosh, in 1979, published it in 1981, in the counterclockwise study. And in that study, what we did was we retrofitted a retreat to 20 years earlier and had old men live there as if they were their younger selves. So they spoke about the past in the present tense. The place was decorated as if it was 20 years early, and so on. And the results were, I think, amazing. I can even say that now because if you turn on The Simpsons Go to Havana, they actually talk about the study. So I can call it a famous study that's out there. In less than a week, without any medical intervention, we found vision improved, hearing improved, strength improved, memory improved, and people look noticeably younger. So that was the very first study. Now we go, there's several from that point to the present, and this book deals with lots of the new research. The main idea is that if the mind and body are one, that means in some sense every thought you have is actually affecting your health. And so in this book, I talk about a new way of understanding stress, decision-making, predictability, risk-taking, and then get to some pretty sexy stories. Because let me tell you, Louis, the book started as a memoir. And so there are lots of personal stories. Then it became an idea memoir. Then it became what it is. But I left many of those stories in, coming clean about a past that was not always perfect, so to speak. I had my partner edited it and took out some of the sexiest stories, but there's still some in there. Anyway, the point is that we have, and this is the bottom line, we have enormous control over our health and well-being that far exceeds what people typically believe.
So can we go deeper into that? First of all, can we start defining so we have a common understanding for everybody? What is a thought? What do you understand by body? And how can we control our thoughts? Can we start
Okay,
from
so
that?
I would like to start, even before that,
Okay.
because when you introduce me and you say I'm the mother of mindfulness, even though I did some of the earliest research on meditation, all the work that's in this book is about mindfulness without meditation. All
Nice.
you need to do to be mindful is actively notice. So people think they're actively noticing all the time, but they're not. Because what happens as soon as you think you tune out. And so what people need to understand is that everything is changing. Everything looks different from different perspectives. So we don't know. Now, a story I'm fond of telling that happened quite a while ago is I was educated at Yale. So I'm Yale, Harvard, oh, so smart. I'm at this horse event. And this man asked me, could I watch his horse? Because he was going to get his horse a hot dog. Well, it was all I could do to laugh because horses are herbivorous. They don't eat meat. Smarty pants, right? He
Yeah.
brings the hot dog to the horse and the horse ate it. And at that moment, everything that I thought I knew became questioned. And what happens is when you know you don't know, you naturally tune in. So what we have people do in so many situations, all different ages, cultures, whatever, you just actively notice things you think you know. You see you didn't know it as well as you thought, and then you naturally pay attention. And when you're mindfully noticing, the neurons are firing, and many, many studies over the last several decades shows us that it's literally and figuratively enlivening. So we have data showing that as you actively notice and the system in some senses is turned on, it's good for you, it's good for your health. Not only that, but when you're mindful, people find you more attractive. Not only that, but when you're mindful, whatever you produce seems to bear the imprint of that mindfulness. So we have, it's good for you, everybody likes you more, you like the world more, you're happier, you're healthier, everything you do is better. It's hard for me to understand that once somebody really understands this, how they wouldn't immediately embrace it. But the biggest problem is that people think they know. So a way of understanding mindlessness is that you're frequently in error, but rarely in doubt. So when I give talks, and we can see this in some senses, my giving the talks, I'll do it here. I ask people a simple question. So Lewis, how much is 1 + 1?
Two?
Answer, Lewis.
Is that two?
2. Okay. Yeah, but not always. So if you add 1 cloud plus 1 cloud, 1 + 1 is 1. You add 1 wad of chewing gum plus 1 wad of chewing gum, 1 + 1 is, you add 1 pile of laundry plus 1 pile of laundry, 1 + 1 is 1. In the real world, 1 + 1 probably doesn't equal 2 as more often as it does. And what people often don't know, excuse me, is that when we say 1 + 1 = 2, that's because we're using the base 10 number system. If you're using a base 2 number system, 1 + 1 is written as 10. So now you take the most fundamental thing that people are sure about, as sure as I was that horses don't eat meat. And now you say, well, wait a second. If things look different in different perspectives, in different contexts, I need to pay some attention. And another thing I might mention, because I'm telling everybody that we don't know, none of us know. And that becomes scary for some people, but it shouldn't, as long as you make a universal attribution for not knowing. That means Luis doesn't know, Ellen Langer, nobody knows. So not knowing is fine. Right now, people tend to make a personal attribution. I don't know, but you know, so I have to pretend. All right. So when you don't know, everything becomes new. Now, I don't remember the question. I do in part remember the question you asked me, what is a body? What is a thought? I'm not sure I can answer that any better than anybody else. But the major point here is that even the concept of mind and body are just words. It's like 1 and 1 is 2. Sometimes 1 and 1 is 2, sometimes it's not. But, our minds and bodies are one thing. Wherever we put the mind, we're necessarily putting the body. Let me give you an example of one of the recent studies we did, which is great fun. I did it with my student, graduate student, Peter Ungle. So we inflict a wound. Now, I'm not so cynical or whatever that I want to hurt people. And the review board is not going to let us really inflict a big wound. So we use a small wound. We use these Chinese cupping method. So with that, you put this plastic thing on you, and it becomes red, and it's a wound. Now, so people create the wound, and then a third of the people are in front of a clock that's going twice as fast as real time, unbeknownst to them. A third of the people are in front of a clock that's going half as fast as real time. And for a third of the people, it's real time. And what happens is the wound heals based on perceived time, not on real time. We have a study that's in progress right now in Sri Lanka, where we have broken legs. And rather than what the doctors typically tell you is, they give you the average amount of time it takes to heal. So for argument's sake, let's say 6 months. What we tell people is some people are able to heal as quickly as, and we give the best healer. And we're expecting then that these broken bones will heal more quickly. That everything about our bodies is controlled by our minds. There you go.
Wow.
You get to talk now if you want to.
Well, thank you. No, I don't want to talk. I just want to ask, because there is so much that we can wave here. I was asking about what is a thought, because as you know, as part of the contemplative process and the meditative process, we always talk about thoughts. But I have this curiosity because I have to explain this as well. And it's always about, is the thought coming after the emotion? Is the emotion after the thought? Are thoughts energy? And if they are energy, we don't create the thoughts. How do we manage our thoughts from the body? So it's all this question of emotions, sensations, thoughts, and energy that I'm not sure everybody understands in the right way. So if you can bring some light on that would be amazing.
Well, I think that more important than questioning what exactly is a thought, everybody has thoughts, ideas, attitudes, views. And the important thing is that they recognize, and this comes from a contemplative tradition as well as mindfulness as I study it, that these things are not real. And if you don't make it solid, that you recognize that it's fluid, that it's sometimes true, it's sometimes not true, then it can help guide your behavior, your thinking, rather than determine, overly determine and make us sort of like robots. So, but emotions is a whole different kettle of fish. And I think, and in the book, I talk a little about the negative emotions people experience, because those are all mindless. That once you recognize, and we've talked about this before, I think Epictetus beat me to it, that events don't cause stress. What causes stress are the views we take of events. And if we take a negative view, of course, we're going to feel awful. But that's not built in to the event. So, for example, a silly one, but Luis, if you and I went for lunch and the lunch was awful, to me, that'd be great because I'd eat less, all right? And if the lunch is good, that's also great, all right? So no matter what happens, that our views determine how we feel. And unless we're mindless, where we presume whatever happens has to be the worst case scenario, and everybody knows that there are good things and bad things, but that's not really what people understand. They think, that let's say there are 10 bad things and 5 good things. So that makes it on some bad. What they have to understand is each and every component is neither good nor bad, or both good and bad. And so in the book, I talk about this with respect to decision making, because right now you make a decision to try to bring about good things, or you make decisions to try to avoid bad things. But if everything that's good is also bad, or bad is also good, depending on how you choose to look at it, the idea of doing something like a cost-benefit analysis is silly, because all the costs and all the benefits are going to be equal, so it's not going to tell you what to do. And, so I spend time on this, and I think reading it, it becomes clearer, because it would take all our time together for me to be totally persuasive. But I think it may be fun to give people the bottom line, which is rather than worry about making the right decision, you can choose any option. The point is to make the decision right. All right. So whatever happens, there was a reason for it to happen, and there are advantages, and you go forward. Now, when people are stressed, they start off with the view that, oh my God, something's going to happen, and when it happens, it's going to be awful. What people don't realize is that prediction is an illusion. We think we can predict because after the fact, we call it Monday morning quarterbacking. Afterwards, you see John and Maria fighting at a party, and somebody says, well, are they going to get divorced? And you say, who knows, right? However, if you don't have that little interaction and you see John and Maria fighting at a party, and the next day you find out they're getting divorced, you say, yeah, I knew it because. Sometimes people fight and they stay together for decades. We don't have to worry about making the wrong decision because there's, whether it's good, bad, or indifferent solely depends on how mindful we choose to look at things. So if you're thinking about stress, for example, if you can't predict, which I argue you can't, and that outcomes are neither positive nor negative, what you need to do when you're stressed, first is to say, you're saying this terrible thing is going to happen. So the first thing to do, possibly, is just to give yourself reasons why it won't happen. And you'd be surprised how easy that becomes. Oh my God, I'm going to fail the test. I'm going to lose my job. My spouse is going to leave me, whatever it is. And then you come up with reasons why it's not. So you went from thinking it's definitely going to happen to maybe it will, maybe it won't. Then turn it around and say, okay, let's assume it happens. How might that actually be an advantage? And, so if you take the relationship, if you're worried that your spouse is going, or boyfriend, girlfriend is going to leave you, it's not a good relationship, that it would probably be a blessing for you then to go and have a more fulfilled life. But at any rate, so the point of all of this is the stress we experience, which I think is the major killer. All right, not a partial thing. The medical model used to say that the only way you become ill is the introduction of a virus, an antigen, something bad, right? And that psychology has no input. It's nice to feel good, but it's not related to anything. Then the model changed, and physicians know that stress is not good for the body. But I don't think they recognize just how bad it is. So I wanted to do the study that I didn't end up doing. It's very complicated, but you'll understand why in a minute. To take people who have been diagnosed with all different kinds of cancer. Now, if you go to anybody who's just told they have cancer, nobody's going to be happy. They're all going to be a little stressed. But, go out 3 weeks, and now the population separates. Where those people who have come to terms in some sense with it differ from those who are still stressed. Okay, so we find out who's stressed and who's okay, basically. And I think that level of stress will predict the outcome over and above genetics, diet, virtually anything. And stress is a psychological concept. So if we can just accept that whatever happens, happens, it's nothing, until we decide to understand it. And the way we understand it depends on how mindful we are. That it could be this, it could be that, it could be changing over time, and so on. When you know that, then it's easier just to sort of sit back and let life unfold, right? If I'm afraid something's going to happen, then I take steps to prevent it. If I'm sure that something is going to be great, people step over other people in order to get it. When you realize it's neither good nor bad, you're able to just be easy and happy.
I really love the mindfulness behind your words. And listening to you, I'm trying to be as mindful as I can. And it's really relaxing. I feel really relaxed. But then I go to chapter 1 of your book, and chapter 1 is all about rules. So what do we do when we want
so
to
what
be
I
mindful
say,
within the framework of rules?
well, that I'm a bit of a rebel. I didn't realize I was until I wrote all of this, but I think it's very important to remember that rules were decided by people. Okay, they don't come from the heavens. And they were decided by people with different views, different interests, likes and dislikes from you. They were decided in the past, and to mindlessly take them into the present is kind of silly. So rules, routines, these should guide what we're doing, not govern what we're doing. When they govern what we're doing, then we're being mindless. We're acting as if these have meaning for all people, at all time. And if you just look at how things change, I mean, forget rules, let's talk about laws. So in the not too distant past, women weren't allowed by law to vote. You weren't allowed to be gay. You weren't allowed to marry anybody who was from a different race. These are outrageous. So now you have all the people for whom that they're behaving illegally, who, if we went back when, hopefully they would have known to question the rule. You can question the rule when you realize it's written by people. Saying, who are these people? There's another thing also about rules in a more general sense. Let's say rules about how to behave. Sports, for example. So when I'm giving a lecture, sometimes I'll look in the audience, and if I can see there's somebody who seems very tall, so I'll get this big guy. I'm 5'3". And if I can find somebody who's 6'5", and oftentimes he exists, and I ask him to come up on stage, and we look silly together. He's up here, I'm over here. And I just raised the question, should we do anything physical the same way? I have him hold his hand up. My hand, comes here. So his hand is like 3 inches larger. Should we hold a tennis racket, a golf club, anything the same way? So to go back to rules, I think that the more similar you are, let's say with athletic rules, for example, the more similar you are to the person who created the rule, the better you're going to do the sport, the activity. But the more important part of that is the more different you are, the more important it is to find your own way of doing it. I heard something on the radio the other day that many people might already know about, but it was new to me. It was about this man who has one arm and yet has become a concert pianist. Now, if people just blindly follow the rules, and you're told the piano, playing the piano requires 2 hands, he wouldn't have even attempted it. So if we should take rules as, maybe, not as absolute. Anytime we take anything as absolute, we tune out and we give up the opportunity to improve our lives, our health, our happiness.
And this very much linked to the second chapter of the book, which is the illusion of control. So we have rules, we have laws, we decide how to play by the book or not. But then we have the illusion of control, and you go deeper into risk, and you really make an amazing analysis of risk. Can we talk a bit more about control and the illusion of it?
Okay. Well, it's interesting that when I was a graduate student, I did the thesis. My dissertation was on the illusion of control. And at that point, I was much more mindless than the years have helped me become more mindful. And I defined the illusion of control as a subjective probability that's greater than the objective probability would warrant. So in other words, we know you can't do it and you think you can. And the more I thought about it over the years, and that, by the way, was, a very influential study in showing people how important control was, that they weren't even going to give it up, dealing with slot machines or chance situations, and important to the development of behavior economics. But still, I went to a different place with it. And when you say you can't do something, who knows that you can't do it? We can never know that you can't do it. All we know is that any way you've tried that failed just means that way wasn't the right way. Um, and it's very important, because when you recognize that you can't know that you can't, and you add to that how much fun it is trying, we can, that's how all the progress is made in the world, where those of us who just don't, who say, yeah, how do you know you can't? So this man with one arm, who says he can't play the piano and learn to play it as well as somebody with two arms, in two hands? But he's not going to play it the same way. No more than I would hold the tennis racket the same way as a 6'5" man whose hand is much larger, unless I'm doing it all mindlessly. Then the world says this is how you do it, as if it's written in stone. And then you try, and it may be very hard for you. If you say, well, that's somebody's idea how to do it, let me do it my own way. Now, what people need to understand is, let's go back to sports, although I know you want to talk more about health, which I do as well. But people think they want to be expert. And by expert, they think they mean perfect. Although somebody who's truly a master of something is always learning. So imagine you're playing golf, and every time you swing the club, you get a hole in one. Well, in a very short time, there's no game there. So people need to understand that it's the not knowing and going from not knowing to knowing a little more that is why we do all these things. Rather than, if it's perfect, then it becomes mindless. So for example, most of us at our age, although our ages are different, but from what is it, 15 or maybe younger, know the rule to tic-tac-toe. Okay. Yes. And once you know it, the game's not fun anymore. And you think you always want to win, but if you did, then play against an 8-year-old. Whatever game you're playing, tennis, golf, crossword puzzles, figuring out equations, whatever it is, so we sort of know intuitively that no, it's a little bit of struggle that helps us feel more masterful. There was some larger point that I was going to make that I lost. So let's just assume it was sheer genius.
Yes, so much. And actually, it's so interesting because I was thinking of health, and you said, I know you want to talk more about health. And I thought, wow, this is telepathy or something. But yes, can we link control and mindfulness to health? Because this is what you do in this.
Sure.
How does it work?
Well, there are several ways. The simplest is that when you believe you have no control, you don't do anything. And so that means all the ways you might have affected the outcome. If you drop out of the game, you can't win. It's just that simple. If you assume that you can't help yourself get better, then chances are you're going to stay the same or get worse. So that's number one. Number two, so just feeling that you're in control leads you to seek out options, and that seeking out information is mindful. So as I said earlier, I have years and years of research where we make people more mindful, the neurons are firing, and it becomes literally life engaging. You live longer and you feel more life, not just living more years. So what we do, I have parts of the book where I talk about what I think is probably our strongest medication, which is placebos. So if you think about a placebo, so I'm the doctor now, you're the patient, and I give you this pill, and you think this is going to be, perfectly wonderful to cure whatever ails you. You take the pill, and then you get better. And the effectiveness of placebos is enormous. Now, if you think about it, if the pill is inert, if it's a sugar pill, if it's a placebo, it's not real medicine. So if you get better, how are you getting better? Well, it turns out you're making yourself better. So that's what my life's work in some sense has been about, is, since we're able to make ourselves better when we go through the charade, why not do it more directly? And so, but how do you give yourself a placebo? Which maybe there's a way, but we came up with what I call attention to symptom variability. Now, what people mindlessly think is when you have a chronic illness or stress, depression, that the symptoms you have stay still or get worse. So people who are stressed, for instance, think they're always stressed. No one is always anything. What happens is that you're stressed, you feel stressed, then you're not stressed, you're just being, then you become stressed again, and that intervening, time away from the stress is not noticed. Okay. We've done what I'm going to tell you with populations that are suffering from multiple sclerosis, Lou Gehrig's disease, arthritis, chronic pain, stroke, big disorders, and we get improvements across the board. What you want to do, the key in some sense, is not noticing when you have the symptom, in some sense, noticing when you don't have the symptom, and then ask the question why. So the first way we did this with people, but I'll tell you how you can do it for yourself, is we call you at random times in the course of the day over a week. And we say, how are we feeling now? Is it better or worse than it was before? And why? Okay, now it's not always easy knowing why, but if we went back to stress, and Luis, you're always stressed, but now you're paying attention to when you are, and what do you discover? When you're not talking to Ellen Langer, you're not stressed. When you talk to Ellen Langer, you're stressed. The solution is easy, right? Stop talking to me or learn how to talk to me differently. Okay, so 3 things happen when you attend to the way these symptoms change. The first is people who have these chronic illnesses think they feel the symptom all the time to equal measure. So the first thing I find out is there are times you don't even have the symptom. Okay, so you feel better. Second, by looking for noticing whether it's better or worse and looking for why, you're engaged in a mindful search for information. And as I said, for decades now, we know that's good for your health. And the last, I think, for me, is the most obvious in some sense, that if you don't look for a solution, you're less likely to find one. So this simple, and it's fun to do. And it takes you do this without your need for the medical world, which doesn't mean you can't go to a doctor if you want or you need to, but while you're waiting for your appointment or waiting for test results or whatever, that you engage in this. Even if you take older people who worry about dementia, all right, my gosh, my memory is so bad, I don't remember anything. Well, everybody remembers some things. And so if you paid attention to what you remember, what you don't remember, the first thing is, gee, I do remember some things. And the things I don't remember them because, let's say because they're negative or they remind me of, somebody I don't want to be reminded of, whatever the case. And then it takes this giant thing that's overwhelming and makes it manageable. So we've done that, as I said, this attention to variability with many, many disorders. To me, it's wonderful to find a way, in a sense, to increase our control over our health, where we can do it without medical intervention, where we don't have to. We can do it without the bills that come along for many people with medical intervention. And again, it doesn't mean one can't do it along with seeking medical help, but it's its own thing. It's sort of a difference between meditation and mindfulness. That meditation is not mindfulness. Meditation is a practice you go through to result in post-meditative mindfulness. And mindfulness, as we study it, is not a practice. It's just a way of being that you engage in, should be engaged in, once you appreciate all the uncertainty all the time. Okay, but they're not mutually exclusive.
Yeah.
One can meditate and one can be mindful in the way that I suggest. One can take care of their own health, and let that be that. But if it's not working as quickly as one would like or as well, seek out the medical world. But we're not helpless. We have control over our health. And staying mindful, early in life, throughout one's life, the medical issues that are going to present themselves are going to be very few and far between, I think. So that's
I really love it. And if we link this further with social connection, there's a part of the book when you are talking about mindful contagion and health.
Yeah, this is amazing.
Yeah,
Let me tell you, Luis, I
please.
almost didn't put this in the book. When I first wrote the book, I had a chapter that I called the woo-woo chapter. Just, things that, that are so wild, but we have data and they feel real. And so even though it's so discrepant with what we tend to think now, I put it in anyway. I'm at the point in my career where, but I tried to make clear in the book, as I will now, that everything that I've said so far stands on its own, whether the thing I'm going to say now or a couple of things are true or not. And, because you don't want to throw out the baby with the bathwater, as the expression goes. All right, so this mindful contagion. Well, turns out, and go back many years, I did this little thing where we had an index card, and on the index card we had written, Mary had a little lamb. That's all. Okay. Or it had, I love Paris in the springtime. And then I would show it to people and I'd have them read it and they'd say, Mary had a little lamb. Or I love Paris in the spring. I said, how many words are on the card? They go, Mary had a little lamb. 5. I said, I'll pay you to be accurate. Mary had a little lamb. They don't know what I'm talking about. Okay. When I showed that index card to people who just finished meditating, they all saw it. When I showed it to kids who haven't yet been taught to be mindless, they all saw it. Well, many years later, Simon and Shabriz did a wonderful study that you probably know about, the gorilla study. It's the same idea, right? People are watching a basketball game, and in the middle of the game, a person dressed in a gorilla suit goes on the court. Nobody sees it because we don't see what we don't expect. So for the mindful contagion, so I have enough evidence that people are blind to what's right in front of them. So now, this is so strange. So now let's say you're mindful and you're sitting next to somebody, not looking at them, shoulder to shoulder. So we have the research participant and we're going to give, so you're either mindful or mindless. And we're giving the research participant, let's say, this index card that has on it, Mary had a little lamb. When you're mindless, the research participant reads, Mary had a little lamb. When you're mindful, they see the double letter. Mary had a little lamb. Hard to explain, but, not so in a sense. If you take a view of the world as, and everything in it is all one, you go back to what was the famous physics experiment, you have a butterfly flapping its wings here, it's going to affect, the other side of the world and so on, that everything you do, everything affects everything else. And so, surely when you're mindful, your body smells different. We don't have the tools yet that are sensitive enough to pick up the differences. But, certainly there's a difference in energy. Everything is different with every thought you have, so I can't explain exactly how it happens. I didn't have the person power to do all the replications. We're doing too many studies and not enough people. But we might have had 3 conditions. So 1, you're mindless. Another, you're mindful. And another, you're mindful, but we have a fan behind you, changing the air. And, with that, get rid of the effect. I have no idea.
Wow.
But we have lots of data separate from this that shows us that when people are mindful, you find them more attractive. And so if you found me as being mindful more attractive, you felt safer with me, somehow I seem to you non-evaluative, that's going to promote your being mindful in a different way. So we have enough data to say it's contagious, even if the mechanism in those different situations is different.
Yeah,
I mean, we
this
have
is
studies where we have, we're doing a wine tasting, and the experimenter is mindful or mindless, and with very little difference. It's not like they're being mean or whatever. They're just noticing new things when they're mindful or they're not. When the experimenter is mindful, the participant drinks less. To the extent that drinking is to dull yourself so that you don't feel as vulnerable to the cruelty and nastiness out there, that the more mindful the world becomes, the less need there would be for excessive drinking, excessive anything, actually.
it's so fascinating. And actually, as you know, I'm a sociologist, and I bring groups to nature, and we do healing in groups in nature. And it's amazing how in a few days, the mindfulness of one person extends to the group. It's just incredible. And working with caregivers, and actually you mentioned that in the book, you can see the mimetic behavior of the caregiver with the person who's being taken care of. So I think that we are into something here very, very important. And you call this at some point during the book, through the book, mindful health. Because if we can go deeper into this social connection and we understand the importance of mindfulness, then we can create new systems of health. So can we talk a bit more about that as well?
But if you just think about it, that there's enormous burnout for healthcare workers. Now, why would that be? Well, it's because they see themselves as doing the same thing, putting out whatever day after day, and not taking anything in, because they think the people they're caring for are the same moment to moment, day to day, and so there's no there in some sense. But when we make the medical world, doctors, nurses, more mindful, what will happen is that it's good for their health. They find the patients that they're caring for more interesting. The patients that they're caring for feel more cared for, because we know when somebody is not there, right? We have expressions in this country like the light's on, but nobody's home. We know when people are just behaving like automatons. They don't really care about us, and so on. The flip side of that, which is the more important in some sense, is we know when they sincerely do care about us, and when they're noticing changes in us, that promotes our health and their health at the same time. So and we have old data, I don't report it in this book, but in one of my earlier books, about how mindfulness has, for lack of a better way, the cure for burnout. That once you think then there's no reason to pay attention. If you day after day, you're not paying attention to whatever you're doing, whether you're a secretary, a doctor, an athlete, no matter what, that if you think it becomes uninteresting, and one can only endure forcing themselves to do what is uninteresting for so long, especially if they have the means to say, I've had enough of this and leave. But everything is potentially interesting. Everything, and, I teach my students to make everything a game. And that's the way I live my life. And so because I'm a happy camper, I try to spread the word. But there's this wonderful video that I show in class. I don't know if you've seen it. It's called Piano Stairs.
Oh, yes. I think
yeah. So So yeah, it's I think it started someplace in Scandinavia where they go down to a subway, and in subway stations across the world, apparently you have stairs, and next to the stairs is an escalator, and so everybody takes the escalator. The random person who's into gym fitness or whatever takes the stairs, but almost everybody takes the escalator. What they did was they laid down a piano keyboard on the stairs. So when you go up the stairs, it makes noise. Do, do, do. Okay. And so because it was such fun, in very short time, everybody was taking the stairs rather than the escalator. Well, so what I say to my students is, why wait for somebody to put the keyboard there? That in your mind, you go up and make it a song, make it a game, no matter what you're doing. And then it all becomes fun. And when you're playing a game, when you're enjoying yourself, you're necessarily mindful. So all the time you're enjoying yourself, you're improving your health.
Wow, I love it. We are actually using the mascot that I have on my backdrop with kids, and they are the combination of 3 animals, and is 192 animals combined into 64. Just by asking them about what do you see, the imagination is sparks, and it's like crazy.
It's wonderful. What we do in schools is, try to get rid of that, and we tell them it's a zebra.
Exactly.
When it could be, instead of black and white, it could be green and orange stripes. And you're told, no, this doesn't exist, and you're also not just told that this is what something is. You're, in some sense, implicitly, sometimes explicitly, told that if you don't get it right, you're going to be punished or ostracized. And so we force kids, and then we become adults in the same way, in these little boxes, afraid to experience a fuller life, which, if again you go back and you say, who decided this is the way? And now at 50 years old, realizing that some 30-year-old might have created that, you say, what, person wasn't old enough, wise enough to tell me what to do, and start doing it your own way, and life becomes a game, I think.
Okay, well, we've been talking now for almost an hour, but I have one question, very important question, to maybe finish and give the sense of this incredible book, as always, pioneering in so many ways this field of positive psychology and mindfulness, and now what you call mindful health and mindful medicine. And so can you give us a sense of what mindful medicine and mindful health is for you? How can we extend this to the world?
Yeah, I mean, it's no different in some sense from just being mindful, which means not locked in categories, recognizing that everything is changing, everything looks different from different perspective. So mindful medicine, well, I think people realize in some sense that if, again, I'm standing next to that man who's 6'5", a big guy, it seems crazy that we should both take the same amount of medicine. His body is twice the size of mine, so we need to vary things, and to know sometimes the medicine that's good for most people is not good for us, and so on. It doesn't matter what area we're looking at. We need to recognize, in some sense, it was all created by people, and that's good, but that means it could be constantly recreated so that it better meets our needs. So when you're mindful, you're necessarily going to become healthier. Almost all of our sicknesses, even a simple thing like, I don't want to give the whole book away, but we give people the false belief that they have a cold, and they get a cold. We don't introduce a virus. We think ourselves sick, we can think ourselves well. We experience things as, oh my God, this is awful, because the world tells us failing a test or being left or whatever is awful. But no, It doesn't have to be experienced that way. Let me tell you a story, and I think I have this in the book. I had a major fire that destroyed 80% of what I owned. This was Christmas many, many years ago. I moved into the Charles Hotel because I didn't have a house to live in any longer. And, you would think that this would be a terrible event, right? Not moving into the Charles Hotel, but experiencing this kind of loss. It's scary. And, oh my gosh. It was around Christmas. That meant that all the presents coming in were burned. All the presents to go out were burned. Now it's Christmas Eve. And I go out to go to somebody's house. And, it's not a happy time. I come back to my room and the room is full of gifts, not from the owners of the hotel, not from the management, but from the so-called little people, the people who park my car, the chambermaids, the waiters and waitresses. It was spectacular, spectacular. And Luis, let me tell you, I don't remember anything that I lost in that fire. Every Christmas, I think back on that, and it makes me feel good about people and to know that there's a lot of goodness out there. One thing that I did remember losing was the notes to my class. This is kind of funny. I had to, in a few weeks, give this large lecture class. All my notes were gone. What am I going to do? What I did was I contacted a student who got an A in the course the year before. I borrowed her notes. It was like a game of telephone, and I announced to the students at the beginning, look, here's what happened. I'll do my best, but, we'll see. And it was probably the best class I had given because I was totally there. I couldn't use my notes because I didn't have my notes. I wasn't expecting perfection from myself. I was real. I gave them information that I found interesting and important, at least at the time. And I think the mindful delivery of the information made it so that they accepted it. And it was a big success. But so the point is that here, terrible, isn't it? I had a major fire. Well, it turns out that, now I'm not suggesting people go burn up their houses, but even in a situation that seems to be presenting so many hardships was actually, for me, wonderful over time.
Wow. Indeed. Well, you know that you are, Ellen, you are an inspiration for all of us in this space of mindfulness as the mother of mindfulness, positive psychology as the mother of positive psychology. And now with this book, The Mindful Body, I think that we have a new beginning as well into something that I feel, and in this case, using my community building hat, is going to be very important for the years to come. How do we heal? How do we heal societies? We are going through collective trauma, and somehow we need collective healing and knowing that we have a mindful body to work on. I think this is so inspiring for all of us and for many people. So thank you so much for everything that you've done, this book, and everything that you are going to be doing. This is always amazing. It's always amazing being inspired by you.
Luis, thank you so much. This was fun for me, and I'm glad I got to meet you almost in person.
Yes.
Stay well.
Thank you so much. Take care.